So, good evening to all. Welcome to chatushpada. Today, we are going to discuss depression. Now, the word depression is itself signifying something which is lying low, which is lying depressed, pushed back, pushed downward. Anything which has a level, a optimum level of a threshold, which is going now down, is called depression. So, if you are maintaining a threshold range of your emotions, and in this range, if you are behaving properly, you have your all your six senses are working properly. It simply implies that you are well coordinated with the external environment. You are feeling happy, you are judging the sorrows as well as happiness, you are visualizing each and everything, and you are almost or near about looking the things where they are placing at is it. But in the case of depression, this threshold range of emotions has now decreased. So above this threshold, anxiety will occur, and below this threshold, depression will occur. So, as this diagram is implying, that there is a slowness in the activity of the patient, and which can be correlated with the coverage phase, or you can be put this depression into the category of coverage unmad. So this is the samavastha. This is the samavastha. Samavastha of emotions, samavastha of perspective, samavastha of your vision, that how you are looking at the things, how you are looking at the problems, what sort of behavior you have, and how much you are afflicted with the external environment. When this is in the normal range, you are just okay with the external environment, means the external factors will not bother you much. You are okay in happiness, you are okay in sorrows. Now, that threshold range, it should be in the balanced form, is very less common. Only those individuals who are or having higher conscious level or having good moon sign in the birth chart. I remember one song which was I was hearing a few days back. That is Nirvana Ashtakam. Nirvana Ashtakam. You should listen that song Nirvana Ashtakam by Shankara. Nirvana Ashtakam. So Nirvana Ashtakam is a very potent song. Basically, it is showing that state of mind, that threshold state of mind where you are not afflicted with the any of the situation which is happening around you. In which Shankara is saying, na papam na punyam. What he's saying that I am not worried about papam and punyam, na sokhyam na dokhyam, either the sukha and dukha, na ninda na stuti. Means if someone is doing your praise, you are okay with that praise. If someone is uh, doing your ninda, you are also okay with that ninda. So that state of mind in which your mood is not affected a bit, your emotions remain stable, your emotions remain stable, or in Ayurvedic terms, you can say a state of sattva. What is sattva? Where there is a balance between rajas and tamas. I have told you many times that the sole purpose of the treatment is to balance the dosha. Try to balance the dosha. Although it's not possible to do the balancing for long term because dosha imbalance varies from lot of factors. But one thing you can balance, that is sattva. You can balance two doshas, rajasa and tamasa, although they're also a bit difficult. But through practice, through consciousness awareness, through tattva bodha, through doing various remedies, various rituals, or simply doing meditation, you can attain that phase of balanced rajas and tamasa, which is called sattva. So, what we have learned so far, that sattva is the balanced state of rajasa and tamasa, or can say that this is above this borderline, rajasa lies, and below this line, tamasa lies. So the sole purpose of all the religion, the sole purpose of Ayurveda is to make a balance between Rajas and Tamasa. Only then you can get the fruit of Sattva. So if patient is moving below to this line, it will lead to tamasic unvada or depression. Clear? This is all about the pathophysiology of depression. All pathophysiology of depression. There is no need to go deep into excessive elaboration of depression. In nutshell, this is the pathophysiology, and this is the striking pathophysiology through which you can select the right drug and right counseling for the patient. Now, tamsa has bit similar symptoms with the vitiated kapha. What are the symptoms of depression? Slowness, slowness in the body as well as in the thoughts process, feeling worthlessness, not engaging in day to day routine, in daily routine. And the most practical symptom I'm going to tell you, which is the symptom of afflicted moon, is that person suffering from afflicted moon or person having a sort of depression, they they are not so active, particularly in the first phase of their day. For example, a person is having bad moon may take time to go for a bath, whereas person having good moon, immediately he will woke up and immediately he will go for bath or any morning routine, and he will get up and ready. Then afterward he will do other course. He might go to a mandir, he might go to uh, a job or work profile place, but he will not delay anything. The moment he wake up, he immediately start. This is a good sign for moon. This is a good sign of moon. Moon, again, that threshold level, that threshold line, if it is going down, that means patient is going in depression. If it is going up, blood patient means patient is going in anxiety. Not engaging in daily routine, body weight gain, letharginess. This I'm talking about the advanced phases of depression, letharginess. Then maybe diseases of metabolic syndrome, metabolic syndrome X. Things go on, things go on, things pile up. Now, what will be the treatment part? How to correct this depression? Remember one thing, you cannot contribute much because this is the fight which patient has to contribute a lot, in which patient has to mend his ways. You can help, you can show the path through medication, through counseling, but in the end, patient has to rectify his own mind. So what will be the line of treatment? First, we are going through few astrological uh, diagnostic tools through which you can assess that why this patient is having depression. First, look for moon sign. Where the moon is located, is moon is happy there? Is there any bad affliction or bad conjunction with the other planet? Conjunction means if a planet, a malefic planet, is sitting along with the moon, that becomes a bad conjunction. Or if a malefic planet is looking at the moon, then also it create a bad conjunction. Few examples which will create depression. The first one is moon plus Saturn, then moon plus Ketu. A lot of other combinations are also there. If moon is placed in not well nakshatra, that is Ashilesha nakshatra. Ashilesha nakshatra is not good. Then moon falling in the Vishakha nakshatra. lot of trouble, lot of obstructions. Moon placed in 6th, 8th, and 12th houses. These are the few diagnostic tools through which you can access, although a lot of other things are there, but that will elaborate this topic. Uh, More deep things are there. But for now, for time being, you should try to make a diagnose by just looking at the patient birth chart. For those who doesn't know how to look at birth chart, looking at the birth chart is very easy. You can go to any online software, AstroSage, ProKerala, any online websites. Just put the patient birth detail, time, place, and look at the birth chart. North Indian birth chart, you can look. I'm not okay with the diagram. Means you have to see the moon sign, MO. Is moon is conjuncted with any malefic planet like Saturn or Ketu. So this is the thing you can see, but I will not recommend you to go for this assessment in advanced stages, in pro stages, when you have a strong command on Ayurveda. After that, you can move a bit toward the medical astrology. If you are to Ayurveda, new in Ayurveda, there is no need to go in the medical astrology because that is a vast separate topic. But first, put your good command in Ayurveda, and after that, a phase will come, a phase will rise where you find that, okay, now drugs are not satisfying my needs. Uh, I need something extra. I have to go more deeper. This medication, this treatment is not worth appropriate, or they are not demanding my needs. They're not fulfilling my needs. In that condition, you can move to the medical astrology because medical astrology is itself a big topic, and it required a lot of energy, lot of resources to study that. But without medical astrology, Ayurveda is complete. Undoubtedly, it is complete. In few cases, for better understanding, for better prognosis, you might need medical astrology. So these are the few combination where you can look at the moon sign, and you can other combinations are also there. If a person is having good Jupiter, Jupiter is the planet of wisdom and the planet of God. Jupiter ethics. Jupiter is a guru. Guru ethics, vision, guidance. If moon is afflicted, but the person is having good Jupiter, still that patient can become happy, or the ill effect of afflicted moon would be less because Jupiter will now take the command in our hands and will guide the patient, will do the tattva bodha to the patient that okay, this thing is good, this thing is bad. Most of the time, afflicted moon patients or patients suffering from depression, they have bad perspective toward the life. Actually, um, they are not clear in their vision that which thing is good, which thing is bad. And Jupiter in such cases will help the patient. Now, coming to the counseling part of the patient. First, we will study that how you can rectify the moon sign. How you can rectify. Although a lot of remedies are there, for that a deep understanding of astrology is needed. Let me tell you the basic remedies which can be applied to any of the patient. You know, moon resembles with the milk, rice plus sugar, or in the collaborative word, it is a paisam, kheer. And patients suffering from depression, anxiety issues, they have to be pretty much uh, conscious about 2 days. That is Purnima and Amavasya, full moon and black moon. Particularly Purnima. कोई ऐसा व्यक्ति आज तक इस दुनिया में नहीं हुआ है जो पूर्णिमा जिसको जिसकी इमोशनल टर्बुलेंस, मतलब पूर्णिमा वाले दिन जिसकी इमोशनल टर्बुलेंस ना हुई हो. बुद्ध was born on Purnima and got enlightened on Purnima. So even the enlightened person are also got affected by the Purnima and Amavasya. So in these 2 days, Purnima and Amavasya, you are on the higher side of your emotions. And history says that most of the madmen got panic attacks on the day of Purnima. So, what will be the remedy? Remedy says that if you donate kheer on Purnima and Amavasya, very few chances are there that you will get emotional turbulence. So, you have to donate. Donation. Donation on these 2 days. Donation with money and specifically donation with the paisam on kheer. You can offer this paisam and kheer to any mandir or any needy person. If you are not able to make a kheer, then simply donate raw milk, rice, and sugar. That will help. Then comes the role of silver. You can give Rajat Bhasma 125 mg BD or OD with the severely afflicted moon, or you're going to ask the patient to wear kada above 50 gram. For male, right hand. For female, left hand. To be worn on Monday. This will help a lot in managing depression. Now comes the counseling part and treatment part. Counseling, in counseling, what you have to do, don't go with the again repeated counseling as done by psychiatrist, psychologist. Don't follow that path. Do a customized counseling. And how to do customized counseling? Identify the root cause of depression. Identify the root cause of depression. Find out Which thing is worrying more to the patient? Which thing is disturbing? Dig more into the personal life of the patients. Don't hesitate to ask any personal questions. Dig deep, either the relationship or either the financial issue or some other issues with the siblings, with the spouse, with the parents, and do counseling according to that thing. And also do the remedies according to that thing. Remember one thing, you can do only effective counseling in one condition: if you are at ease at that moment. If you are not, uh, you must remain in the silent phase. Be a good listener. First, be a good listener. और जब listen कर रहे हो, just look deep into the eyes of the patient. Or if you're not comfortable with that, then in between two eyes, above nose, there is a point where we put tilak and bindi. Just try to focus on that point. If you're not comfortable in looking into the eyes of the patient, just look around this region. And trust me, by just looking at this point for 5 minutes at least, during the counseling, during the consultation, you will find that patient suddenly start getting relaxed. He will connect with you. And the moment you see that patient has now connected with me, strike back on those triggering points where patient is getting disturbed. Bring the tattva bodha into the patient. Tattva bodha. Tattva bodha means bring the patient into the reality. And what is the reality? Reality is that we are all alone. We are here to do some special purpose. Everyone has a design purpose. And our happiness is not bound with any external environment. Our happiness is internal. It is not depend upon finances, it is not depend upon spouse, it is not depend upon siblings. It is something internal. And what that internal thing, that everything flows. This shall too pass. Be a observer. Sakshi bhava. This shall too pass. Okay, you are going with a bad time. It will be pass. Don't worry about that. Plus, but maintain your emotional balance. So slowly counsel the patient regarding this. And one thing I have found which worked in almost all the cases of depression, that you have to bind the patient with a particular routine. Any routine you can ask the patient. Time bound routine. You can ask the patient to do a remedy of Surya Arka. Surya Arka means giving water to Surya within 1 hour of sunrise for 14 days. With copper vessel, you can add sindoor into it, pinch of sindoor or jaggery. Ask the patient to do this remedy for 14 days continuously, a particular time, means within 1 hour you have to do this remedy. And trust me, by doing this remedy, you will find that a routine will develop. There will be low chances of emotional turbulence. There will be low chances of depressions, sadness. Patient will get sort of good energy. Patient will be active. Patient will get the energy of sun, which is hindered by moon. So patient will get the pranic energy. It has tremendous result. Other remedies are also there. You can adopt any dincharya mentioned in Samhita. The sole purpose is to bring the patient into routine, into a punctuality, so that the tamasic bhav, the tamasic content, the lethargic part, which is contributing stress or depression, can be measured. Now come the treatment part. Means herbal treatment part or therapeutic treatment part. First, because such patients are having uh, kapha predominant doshas, tamasic dosha, so katu ushan tikshan oshada should be given. Mal anulomana, and in mal anulomana, haritiki should be included. Haritiki should be included. Katu ushan tikshana, mal anulomana, haritiki should be included. So Brihad Vashvanar Churan, any Oshada which is anulomana in nature and which increases the digestive fire. Anulomana and increases the digestive fire are the good drugs for depression. Breath Vaishwanar Churana, Trikadu Churana. These are the initial medicines which can be given patients suffering from depression. Arogyavardhani Gudika. Then Brahmi Grit. And in severe depression, you can give Panchagavya Grita. Friends, if someone is having suicidal thought tendency in depression, one drug which is effective in averting that thoughts is Manas Mitra Vadkam. Manas Mitra Vadkam is a Prabhav Karam Oshad which can be given in any of the psychological diseases. Manas Mitra Vadkam. Preferably give Kotakal company. Then Jatamamsi. Jatamamsi Kalka or Jatamamsi Churna, anything you can give. This is all what for depression. These are the drugs. You have to select the Ushan Tikshan drug, which can bring the consciousness in the patient, which will irritate the patient, bring in the consciousness, which will remove the tamasa, which will remove the darkness around the mind. So any drug which removes the darkness, which removes the kapha, which removes the tamasa bhava, is the best drug for depression. Don't try to give sedative medicines in depression, cooling medicine in depression. Don't try to give. Always give pungent oshadi, pungent medicine, which is ocean in nature, diction in nature, and stimulant in nature, which ignite the, focus on the word ignite the pragya. Ignite means fire. So give ocean, diction, oshada. So this is all about for depression. The main thing in depression, you have to understand the pathophysiology. You have to strike down the causative factor. You have to pinpoint the root cause of afsada. According to do that, you have to do counseling. This is all about for depression. After that, few role of medicine will come. So if you have any question regarding this topic, you can ask. Sir, can you please take a bit loud? I think I'm louder. Is everyone facing the same problem with the voice? Kindly tell me, is everyone facing the same problem? Low voice. सर तमस कफज पेशेंट काउंसलिंग टफ टास्क होगा. ये पेशेंट इजीली इंप्लीमेंट करेगा कमांड को? टफ. दैट्स व्हाई आई हैव elaborated in a very vast way with the help of astrology also. It's a karmic thing, but still, being a Vaidya, as your inner consciousness will develop, you can counsel such patients too. Can female patient do? Yes, yes, you can do Surya Arka on menstruation day. On menstruation day, you should avoid. On menstruation days, you should avoid. Yes, nasyam pradhaman nasya with the tikshan oshada you can give. Tikshan oshada you can give. Sir, in depression, they hate to schedule particular. Yeah, this is the obstructing point. Na? You have to tackle that point. And if that is uh, if patient is hitting that point, it means the result lying in that point. If someone is avoiding that task, one wise person has told in a quote that the miracle you are looking for is the work you are avoiding. The miracle you are looking in your life is the work that you are avoiding. So that thing which you hate to do, there lies the whole treatment. I have told you, patient with depression, they hate to be on schedule. But if with any measure, even if the single measure, simple measure, okay, if patient is not willing to do Surya Arka daily, you can ask the patient to visit temple, or you can ask the patient to do this thing on that time. You can ask the patient to take bath on this particular time. Okay, you have to take bath on 8 o'clock morning daily without any break. And with that simple remedy, you can find over a period of time that tamasa will start getting away. Shirodhara, Shirovasti is not indicated. It's not useful. It might be useful in anxious related cases, but in depression, it is not useful. How to tackle? They are prone to procrastination, right? They are very prone to procrastination, and only one thing can Decrease the procrastination is routine. Writing habits, writing habits. Daily write down your tasks. Okay, I am waking up. These are the things that I have to do today, and I have to finish by anyhow. You know, these type of stubborn nature is coming from a lot of birth. It's not easy to work upon these type of things, but you have to start either in this birth or the next birth, but you have to start. You cannot run away from this thing. You have to work on this thing. So the best remedy for procrastination is routine. सर रजत भस्म कितने दिन दे सकते हैं, व्हाट ए पर्टिकुलर इंडिकेशन? यू कैन गिव रजत भस्म फॉर 2 to 3 months. If moon is afflicted, in such cases you can give rajat bhasam. If the patient is having a pitta predominance, you can give rajat bhasam. If moon is emotional turbulence, means if emotional turbulence is there, you can give. Patient is not able to focus, in such condition you can also give rajat bhasam. Sir, can we give Brihat Vaishnav to Pittaj or Vataj patient? Yes, you can give. You can give according to the yukti. The patient is too much of in Pitta nature, go with the smaller doses, go with the smaller follow-ups, observe the patient like that you can manage. What about Shirudhara, Shiruvasti Tel Dharam? Shirudhara, Shiruvasti Tel Dharan is not recommended in depression. Pradhaman Nasya, Vacha Churna Pradhaman Nasyam is good. Any Ushan Tikshan Nasyam is good. Sir, my friend doesn't take bath on Saturday, having stressful work week. She feel depressed to do daily chores. Yes, what is the solution? Routine. You have to ask the patient to do the routine, and you can take the help of Saturn. Ask your friend to donate jaggery containing sweets on Saturday. That will also helps in increasing the uh, punctuality. Also, you can offer laddu to Shri Ganesha. Shri Ganesha is the symbol of laziness, letharginess. So offering laddus, besan laddu on Thursdays also shows good result. But ultimately, patient has to work upon his mind itself. If patient is obese and facing depression, can we add? Yes, Varanadi Kishaye, Varadi Kishaye, Navayas Loho Churna, Arogya Vardhani, Ayas Kriti. You can give any Ushan Tikshan Oshada. Navayas Churan shows good result. Um, Ayas Kriti shows good result with obesity and depression. Likewise, lot of combinations are there. You can select according to that. Dr. Chandan, thank you, sir. You're welcome, Dr. Any other question? So this is um, all I have to offer on depression. I think with this type of explanation and elaboration, and we have covered the multidimensional approach of depression. I have justified this topic. Rest over a period of time, you will get good command on depression. Please repeat Jaggery and what else on Saturday? Jaggery sweet on Shani Mandir on Saturday. That will also reduce the procrastination. Jaggery sweet, Shani Mandir on Saturday. Sir, ice kriti non-diabetic patient also. Yes, you can give. You can give obese patient ice kriti. You can give. No problem. Any question? Dr. Pushpinder, thank you so much. Thank you, Dr. Saab. Panchagavya Manas Mitra Vadkar, for how long we can, unless the symptoms got resolved, unless the symptoms got resolved, minimum 6 months you can give. There's no problem in that. Why I have selected Panchagavya? Panchagavya Grita is a kapha pacifying drug. So it brings the chetana. Panchagavya Grita, as you, those who are enrolled in neurology part, I have discussed that Panchagavya Grita is very much effective in seizures related with the kaphaja type. So it just bring the consciousness in the patient. Can you make Vivastha Patra with combination of doses? Panchagavya Gritam 5 to 10 ml at bedtime along with the honey. Along with the honey, if you make it more potent, if you doesn't want to make it more potent, simply give Panchagavya Grita 5 gram at bedtime. Let me write it down. Panchagavyam Gritam. 5 to 10 ml bedtime. If you think that patient is more in kaphogen nature, you can select honey 2.5 ml. Along with you can give Manas Mitra Vodka. One at bedtime. Sir, but Rajat is cool. No, Rajat is cool, but if the moon is afflicted, if moon is in the turbulence in nature, if moon goes in an impulsive way, ups and down, in that condition you can give Rajat. I'm not asking to give Rajat Basam in purely in depression, but if you see that moon is not good, go with the Rajat Basam. How to convince a depression patient to Surya Arka if she is not so much reluctant to do anything? Then leave that patient. High karmic load is there. You cannot do many things. Try to go with the medicine. Try to go with the medicine. Bring a space. Create a space for a patient to hear you. After that, you can adopt these measures. Is there any question left? सर मानस रोगों को मज्जा धातु से रिलेट, वो अभी नहीं, बाद में उसको रिलेट करेंगे. एंजाइटी में हम उसको रिलेट कर सकते हैं, है ना, कर सकते हैं उसको रिलेट, लेकिन वो क्या है कि इतना डीप पैथोलॉजी पैथोफिजियोलॉजी नहीं है ना. सो आई एम टॉकिंग ए बिट हायर स्टेट ऑफ कॉन्शियसनेस. मज्जा धातु ठीक है, लेकिन मज्जा धातु अगर आप ट्रीटमेंट करते भी हो, यू विल नॉट गेट डिजायर रिजल्ट. इन महाराष्ट्र साइड Vaidyas, they do Majja Dhatu treatment. But I have seen that not good result is there. Why? Because your approach is not right. Majja Dhatu is Shaya is happening byproduct, but the root cause is something else. So unless you strike the down the root cause, you will not get the desired result. Can we speak in audio? Yes, you can speak in the audio. You have to raise your hand. Then I have to. Um, yes, Dr. Ashima Sirdana. Dr. Preet Kamal has raised her hand. Yes, Dr. Saab, you can ask.
हेलो सर, थैंक यू।
हाँ जी, वेलकम वेलकम डॉक्टर साहब, बताएं।
अच्छा सर, जैसे आपने कहा कि हमें इसको इनिशियली कटु उष्ण तीक्ष्ण और मल अनुलोम करवाना है।
हाँ
तो यू गिव अस थ्री ऑप्शंस, सो बृहत,
हाँ,
वैश्वनरा, त्रिकटु एंड आरोग्यास, सो वी कैन यूज एनी वन ऑफ दीज और टू ऑफ
any of
दीज।
these drug, or and you can pick the other drugs too, depending upon the availability and association of other diseases along with the depression. For example, if patient is having piles, non-bleeding pile, and also is having suffering from depression, in that condition you can go with the uh, Hutbugadi Churna, which is a great medicine. Along with that, you can choose any kashai like uh, Dusparshkadi or kashai like Chirvilvadi. So likewise, you can manage, because it's not possible for me to discuss all those drugs. So I usually mention the specific drugs, but you can pick any of the drugs from any of the mentioned diseases. You got my
ओके, और
point?
सर आपने कहा, यस
Hmm.
सर, थैंक यू
Hmm.
सो मच। और आपने
Hmm.
जैसे व्यवस्था पत्र बनाया कि यू सेड पंचगव्य, घृतम एंड मानस पत्र both can be given together, right? So
Hmm.
these both should be enough to bring the result, or we should add. So like when we should give Brahmi Grit or Jatamansi Churan.
Brahmi Ghritam, Jata Mamsi Ghritam, both are stimulant in nature, and they are bringing consciousness to the patient. Panchagavya Ghritam is bit on higher side. If patient is having the uh, tendency of forgetfulness, dementia, poor IQ, not connecting to you well, and in such condition, Brahmi Grita you can give, Jeta Mamsi Grita you can give. But if patient uh, is bit higher on Kapha side, but uh, IQ is good, but letharginess is there, and also there may be history of seizures or any other illnesses. In such condition, Panchagavya Gritam you can give. So Panchagavya Gritam uh, is advanced medicine for hair and for depression. You can give or select Panchagavya Gritam when these two Brahmi Gritam or uh, Jeta Mamsi Kalka, they are not showing good result. In such condition, you can give.
Okay. And
Mm.
sir, you said they can be given as long as the person is not feeling
Yeah,
better,
unless
right?
you got the desired result.
Okay. How much? Just estimate how much time it will take to
Minimum
for us to get the result. Just an
three, three
idea.
to six, 3 to 6 month.
Okay.
Mm.
And then if the patient says, "Oh, they are feeling better now," then should we switch to another medicine, or we can continue with the same?
You can continue for another few follow-ups. After that, you can taper down that medicine, or you can go with the lighter version of that medicine, or you can just ask the patient to follow the pathya pathya.
ओके।
Mm.
और सर, जो आपने कहा कि जो सूर्य अर्क है, उसका
हाँ,
बेसिकली मेन पर्पस है कि पेशेंट को स्केड्यूल में लेके आना, राइट?
यस यस, मेन पर्पस है, पर्पस और भी बहुत है।
ओके।
सूर्य अर्क एक तो जॉइंट रिलेटेड प्रॉब्लम नहीं आपको होने देगा। If someone is having arthritis, someone is having osteoporosis, Surya Arc will help. If someone is having bad luck, Surya Arc will help. If someone is having poor ojas, poor glowness in the body, Surya Arca will help. If someone is having fights in his life, in her life, Surya Arka will have. So a lot of benefits are there, but uh, in
तो सूर्य बेसिकली करता क्या, ये क्या चीज पे करता है
Surya
टारगेट?
is a pranic energy. Surya
ओके।
governs all the planets. सूर्य इज द एनर्जी. आप ऐसा ही देख लो ना, सूर्य अगर ना निकले तो ऑल योर वेजिटेशन विल डाई, ऑल योर अग्नि विल स्लो डाउन, आपके सारे काम रुक जाएंगे. तो सूर्य एक एनर्जी है ना, एक सोर्स है. सूर्य अगर ना
गॉट इट।
होगे तो यू विल फाइंड कि सब कुछ डाउन जाएगा. तो सूर्य इज एनर्जी. सूर्य आल्सो रिसेंबल्स योर फादर. So how is the result of Saraswata Rist gold in depression? You can give Saraswata Rist gold in depression too. But anxiety, it's not show good result in anxiety. In Saraswata Rist, where patient is having forgetfulness, stammering issue, low IQ, in such condition you can give. We will discuss Saraswata Rist later in our lecture series. Dr. Preet Kamal, are you done with your question?
यस सर, थैंक यू, I'm going to lower my hand.
Okay, okay. Now I am moving toward Dr. Ashima. Dr. Ashima, you can ask your question. You have raised your hand. You can unmute your microphone and can ask the question straight away. If you are done with your question, I think you have already asked it in the chat box. And also you can load on your hand. Okay. Sir, can we use Smriti Sagar Ras? Yes, you can uh, give Smriti Sagar Ras, Rajat Sindur, Ras Sindur. All are Tikshan Ushana Oshadis. You can give, no problem. Okay, doctor. Any food restriction to follow when having Panchagivagritam? Fast food, habit to digest food, these things should be avoided. Food which hampers the efficacy of drugs, that should be avoided. Outside food, a wrong combination, that should be avoided. Rashima sir, answer mil gaya. Thanks. Welcome, doctor. So it will be a final call. If you have any question, you can ask.
सर नस्या में आपने कुछ मेंशन किया था, नाम
Vacha,
मैं
vacha,
नोट नहीं।
vacha चूरन.
वच्चा
पथ्य पथ्य,
चूर्ण का
हाँ.
नस्या।
हाँ.
सर
पथ्य
कोई
पथ्य.
ऑयल नहीं है, लाइक चूर्ण तो लाइक डिफिकल्ट थोड़ा होगा पेशेंट के लिए।
Anutel, Anutelam Nasyam you can give.
वो अनुतैलम।
पथ्या पथ्या फॉर डिप्रेशन. पथ्या पथ्या वही जो कफ वर्धक आहार विहार है, जो स्लोनेस लेके आए, मैदे वाले खाने, जो बासी खाना है, जो रॉन्ग फूड कॉम्बिनेशंस है, वही पथ्य पथ्य. सर बट अबाउट पर्ल पाउडर, आई हैव नो एक्सपीरियंस विद द पर्ल पाउडर. नो. डॉक्टर पुष्पिंदर हैज रेज्ड. नो, आई थिंक इट विल बी बाय मिस्टेक. सद्यो बमन, यस, बहुत अच्छा है. सद्यो बमन बहुत अच्छा है, कफ का तो बेस्ट मेडिसिन है सद्यो बमन. वमन भी प्लान कर सकते हो आप. अच्छा है. आप सभी ना एक जगह क्वेश्चन पूछो, कुछ क्वेश्चन एंड आंसर में पूछ रहे हैं, कुछ चैट में, तो फिर मेरे से निकल और नहीं हो रहा. आप चैट बॉक्स में क्वेश्चन पूछो. सर डोज रजत बसम हेल्प इन विच योगा? डस रजत बसम हेल्प इन विच योगा? डोनेशन विल हेल्प. Donation will help. If moon and Saturn is there, you have to take care of your sisters, you have to take care of your daughters. And person having wish yoga, they have also have the tendency of problems in their tooth. So they have bad oral means you can there will be diseases in the oral cavity. So donating or taking care of sisters and your daughters will surely help. We have a tradition to give something uh, on every question to our sisters and daughters. Nowadays, it is not following properly, but our elders, they have a habit of giving uh, whatever they something they got in their house, they immediately give some share to their daughter or to their siblings, particularly females. So this habit of donating towards your daughter or your sisters, it will eventually helps in rectifying your mood. It will strengthen your mood. सर प्लीज रिपीट दिस. क्या रिपीट करें डॉक्टर साहब, समझ नहीं आया आपका. आप चैट बॉक्स में पूछिए क्वेश्चन. अश्वगंधा नहीं, कामनेस नहीं लेके आना माइंड में ना. डिप्रेशन में कामनेस नहीं लेके आना आप. डिप्रेशन में तो माइंड ऑलरेडी बहुत काम हो गया है, उसको इग्नाइट करना है ना. तो उसको स्टिमुलस देना है. नो आई सेड इट डजंट वर्क. यस यस, इट डज नॉट वर्क. इन एंजाइटी इट विल वर्क, इन डिप्रेशन इट विल नॉट वर्क. सर, this aspect of donating to daughters, in which condition this should be adopted to all of us, but for particular those patients who are having moon with Saturn, for those person they have to mandatory give donation to daughters and their sisters, or they have to do kanya pujana on Navratra. They have to do. Always in your family, if you are getting some good profits, if you are getting some good shares, give some share of your profit to your sisters, your daughters, on time to time basis, particularly on festivals, on certain rituals. And you have to give them. Don't take anything from them, you have to give them. In such a way, your moon will get strengthened and karmic load will decrease down. हमारे एल्डर्स भी करते थे ना, जब लड़कियों के घर जाते थे तो कुछ खाते नहीं थे, पानी भी नहीं पीते थे. तो उन चीज़ों का कुछ मतलब था, ऐसे नहीं बने थे वो रिचुअल्स. उनका कुछ मीनिंग था, ऐसा नहीं था. वो रीज़न, वो चीज़ें धीरे धीरे लुप्त होती गई, तभी ये प्रॉब्लम्स आ रही हैं, है ना. तो वो छोटे छोटे रिचुअल्स हम करते ही रहते थे, हमारे एल्डर्स करवाते ही रहते थे कुछ ना कुछ हमसे. अभी आप देखो, पूर्णिमा अमावस्या वाले दिन डोनेशन हम करते थे, शबील लगाते थे एकादशी वाले दिन. फिर ऐसे हम छोटे छोटे रिचुअल करते रहते थे, सो दैट कि अवर सोल रिमेन हैप्पी. अभी वो चीज़ें ख़त्म होती गई, अब मेडिसिन पे जोर आ गया. तो इसलिए कुछ ऐसी डिजीजेज आ गई हैं जो कि मेडिसिन से ठीक नहीं होती, क्योंकि उनका ट्रीटमेंट रेमेडीज में है, उनका ट्रीटमेंट रिचुअल्स में है. तो अनलेस आप रिचुअल्स को फॉलो नहीं करते हो टाइम टू टाइम, तो नहीं बात बनेगी. Okay, then I think we have concluded all your questions. Sir, which Ayurvedic medicine is best for detoxification of mind? A lot of medicines are there depending upon dosha predominance. Brihad Vaishwana Churna is good, which is going up to the level of mind. Other medicines are too effective. Panchkarma followed by Virechana, Snehana followed by Virechana, Vastis. All medicine which are shodhana in nature, they purifies the body and mind. All karmas which are shodhana in nature, they purifies the body and mind. All medicine which removes the inflammatory mediator toxins from the body, all medicines which are mala anulomana in properties, which are agni pratipana in properties, are best for detoxification. Is there any question? संज्ञा स्थापन करना दे सकते हैं, दे सकते हैं। जो कॉन्शियसनेस को स्थापित करे वो दे सकते हैं। अब देने को हर चीज दे सकते हैं आप, लेकिन क्या है कि वो जस्टिफाई नहीं होता, है ना। देने को आप कुछ भी दे सकते हो, क्योंकि दोष तो तीन ही है। तो कोई सी भी चीज घुमा के आप दे सकते हो, लेकिन क्या है कि जो डिजायर हैं, जो इफेक्टिव रिजल्ट देती हैं, वो मैंने आपको बताया। सर विच आयुर्वेदिक मेडिसिन फ्रॉम वेयर डू वी स्टार्ट इन आयुर्वेदा, विच कोर्स ऑफ योर मस्ट। देखिए, अगर आप मेरे से आयुर्वेद पढ़ना चाहते हो तो हमारा एक आयुर्वेदा फाउंडेशन कोर्स पार्ट 1 है, फिर पार्ट 2 है। पार्ट 1 इज़ फ्रीली, वो आप फ्रीली देख सकते हैं। उसके बाद पार्ट 2 है, और उसके बाद हमारे कोर्सेस अलग अलग स्पेशलाइजेशन पर है। गैस्ट्रो का है हमारे, देन जॉइंट पेन पे है, आम वात पे है। बड़े सारे कोर्स हमने लिए हैं, और आने वाले आगे भी हम कोर्सेस ले रहे हैं। तो यू कैन फॉलो, बट स्टार्ट विद द आयुर्वेदा फाउंडेशन कोर्स पार्ट 1 एंड पार्ट 2। अगर बेसिक्स आप क्लियर चाहते हो तो आयुर्वेदा फाउंडेशन कोर्स पार्ट 1 एंड पार्ट 2। सर विच आयुर्वेदिक मेडिसिन टू गिव फॉर सेलुलर वेलनेस माइक्रोकॉन्ड्रियल। डॉक्टर साहब, जो सारी मेडिसिन अभी आपको बताई सारी उसी पे चलेंगी। जो टॉक्सिन बाहर निकाले, जो मेडिसिन मल का अनुलोमन करे, अग्नि को प्रदीप्त करे, स्रोतों को खोले, वो सारी सेलुलर वेलनेस को ठीक करेंगी, माइटोकॉन्ड्रियल ऑप्टिमाइजेशन को ठीक करेंगी। हमारे में कोई अलग से मेडिसिन नहीं है, यही काम करेंगे। अंडरस्टूड सर, थैंक यू, यू आर वेलकम डॉक्टर साहब। So I think with that question we are concluded our this session. Don't worry, if you have any question you can ask in the next lecture. You can ask in the WhatsApp group. We have a lot of other topics still in the pending mode. You can ask in any of the lecture. So with that note, I'm signing off. Thanks to all for joining this wonderful session. Keep learning, keep growing, and Ayurveda is a great science. We are lucky that we are in the field of Ayurveda, because it's not only about treating the patient, it's about treating yourself too, treating your karmas too, rectifying your birth too. So, with Ayurveda, you can mend your many births to come. So, that's why it has been told through Ayurveda you can attain dharma, artha, kama, moksha. So, Ayurveda is super science. So, thank you all. Good night.